friends, today's topic is a very important topic, that is posterior palatal seal area. It is very important in the clinical point of view also and also for the exam point of view. So let's begin posterior palatal seal area. Here, this is the posterior palatal seal area, and it is defined as the area between the anterior and posterior vibrating lines. So this is the anterior vibrating line and this is the posterior vibrating line, and the area in between these lines are called posterior palatal seal area. Here this is the intraoral picture of posterior palatal seal area. This is the posterior vibrating line and this is the anterior vibrating line, and the area in between these two lines is called posterior palatal seal area. Okay. So what is the vibrating line? It is an imaginary line across the posterior part of the palate, marking the division between movable and immovable tissues of the soft palate. And this can be identified when the movable tissues are functioning. So this is the posterior vibrating line, and here this is the anterior vibrating line, and this is actually, this anterior border is indistinct. Okay. And this is the area in between the anterior and posterior vibrating lines, that is posterior palatal seal area. Okay. What is the posterior palatal seal area? What is its definition? Actually, it is defined as the soft tissue along the junction of hard and soft palates on which pressure within the physiologic limits can be applied by the complete removable dental prosthesis to aid in the retention of the denture. So this is the posterior palatal seal area. And this is very important in the maxillary complete denture fabrication, and it must be identified and evaluated. And it is the area of compressible tissue located lateral to the midline and in the posterior third of the hard palate. So this is the vibrating line, which is very important feature to be located in the construction of maxillary complete denture. It can be considered as the junction between hard and soft palates and is important because it is the maximum posterior limit to the maxillary denture. This is the picture showing the sagittal section showing the anterior vibrating line and the posterior vibrating line. This is the sagittal section. Here, this is the anterior vibrating line and this is the posterior vibrating line. This is palatine upper neurosis. Okay. So this is the anterior vibrating line and this is the posterior vibrating line. And what is the anterior vibrating line? It is actually an imaginary line at the junction of attached tissue overlying the hard palate and the immediate movable tissue of the soft palate. And it is always on the soft palate. Here, a projection there, that is the posterior nasal spine. So, due to this projection, anterior vibrating line is not a straight line. It takes the shape of a cupid's bow. Actually, it is located by Valsalva maneuver. Here, the patient is asked to hold both the nostrils and gently blow through the nose. And this will place the soft palate inferiorly at the junction of hard palate, and the junction then be marked. And it can also be located by instructing the patient to say "ah" in short vigorous burst. That is anterior vibrating line. So coming to the posterior vibrating line, it is a very important feature to be located in the construction of a maxillary complete denture. And it is an imaginary line at the junction of aponeurosis of the tensor veli palatine muscle and the musculature of the soft palate. And it is a slightly curved line. And it can be located by instructing the patient to say "ah" in short bursts but in a normal and exaggerated manner. Okay. This one is the anterior vibrating line, This is actually a shape of a cupid's bow. Okay, this is the anterior vibrating line. Due to this posterior nasal spine, it is like a shape of a cupid's bow. Okay, and this is the posterior vibrating line. It is slightly curved line. Okay, this is the distal extent of the denture. Here, this is the hamular notch. Actually, this is lying between the maxillary tuberosity and the hamulus. There is a groove which is called the hamular notch. And this notch is a key clinical landmark in the maxillary denture construction because the maximum posterior extent of the denture is the vibrating line which runs bilaterally through the hamular notches. Okay. And this seal consists of two separate but confluent areas. That is, here this is the pterygomaxillary seal. It extends through the hamular notches for 3 to 4 mm anterolaterally, approximating the mucogingival junction. And this is the postpalatal seal. It extends medially from one tuberosity to the another. Okay, and this is the posterior palatal seal area. Width and depth of the posterior palatal seal depend on the type and displaceability of the soft palate. And the functions can be divided into its importance when incorporated in the impression tray and complete denture. Okay. So functions can be divided into its importance when incorporated in the impression tray and complete denture. So impression tray, it establishes positive contact posteriorly and prevents impression wash material from sliding down the pharynx. It guides the positioning of the impression tray. It creates slight displacement of the soft tissues and helps verify retention and seal of potential denture border. Complete denture, primary function is the retention of the maxillary denture. It reduces the gag reflex by reducing the patient awareness of this area, prevents food accumulation beneath the posterior aspect of the denture, reduces the patient's discomfort when contact occurs between the dorsum of tongue and posterior part of the denture, compensates for the volumetric shrinkage that occurs during polymerization of methyl methacrylate resin. Okay. So finally, the scraping of the cast. This is the functional scraping of the cast. Here the sections made through the deepest portion. This is the deepest portion, that is black line. Okay. And the mid-palatine suture and the hamular notch. These are the mid-palatine suture and the hamular notch. These are the red lines. Okay. So here this is the sagittal section showing depth of the scraping in deepest portion, that is 1 to 1.5 mm. And mid-palatine suture and hamular notch areas, that is 0.5 mm. These are the various advantages and disadvantages. The advantages are it has increased retention. Due to this, it enhancing the accuracy of the jaw relation procedure. And the patient can experience and is aware of the retentive qualities expected from the final denture. Dentist also aware of the amount the retention denture will possess. Adjustment period with regard to the posterior extension of the denture is less for the patient. And the disadvantages are, it is not a physiological technique, it is technique sensitive. Excessive scraping of the cast can lead to over post damage. Okay. So coming to the arbitrary scraping of the master cast. It is done by the technician prior to processing of the denture when the dentist fails to establish the seal clinically. And it is an arbitrary notch here. Okay, this is the arbitrary notched line which is formed in the imaginary posterior palatal, posterior vibrating line which extend into the hamular notches. But it should be discouraged. So this is the arbitrary scraping of the cast. Coming to the fluid wax technique, here any wax that is designed to flow at mouth temperature can be used in this technique. Here the seal is established after making final impressions but before pouring the master cast. Zinc oxide retinol and impression plaster are the suitable impression materials used for this technique. Anterior and posterior vibrating lines are marked as described in the conventional technique and transferred to the final impression in the mouth. Fourth one is the low fusing compound. Here this is the green stick compound which can be used to make an impression of the seal area using a similar procedure as described for the fluid wax. Coming to various errors in establishing the posterior palatal seal. First one is the underextension. Most common cause for posterior palatal seal failure and leads to loss of retention, that is underextension. Next one is the overextension. Then under post damming and over post damming. Okay. This is the shape of an average posterior palatal seal area, which is indicated in the blue color. Noted that the black line indicating the vibrating line, and it is the most distal extent of both the posterior palatal seal area and the completed denture. And the green area, it represents the area of hard palate that often has soft tissue that can be compressed approximately 0.5 mm. And the orange area, it indicates the tissue that can generally be compressed approximately 1 mm. So stone will be removed from the master cast in this shape and the depth as a laboratory procedure ending in a feather edge in the anterior. Okay. So this is the completed maxillary final impression with the outline of the posterior palatal seal drawn on the impression with an indelible marker. That is all for today's lecture. Please do like, share and subscribe my channel for more videos. Thank you.